Hi, this is Brian Carson with Signature Dental Studios. Today we're going to talk about a practical approach to immediate dentures using the rule of thirds. First, we take our impression. We want to inspect it, make sure there's no pulls or obvious defects. We want to make sure that the impression is room temperature, and then we can prepare it by boxing and beating for it to be poured. Next, we're going to use the Renford Twister Evolution to vacuum mix our die stone. Make sure you use the proper water to power ratio as per manufacturer's suggestion. And the Renford makes a nice creamy consistency of your die stone, which leads to a smooth cast once poured. Here we are, we have our impressions, they're boxed and beaded. We're starting the pouring process. And now we have our casts, we have our bite registration. We want to trim our bite registration to make sure there's no interferences of the cast coming together. Make sure it's a solid foundation. We don't have any squishiness or bounce effect there when they're together. Now we can have our case mounted. We want to make sure it's intimate. We want to make sure the wear facades are lining up. This gives us a nice ability to keep a ridge relationship there after teeth are gone. Plus, when you have the teeth socked in nicely together, it gives us a reference point in case we have to open up the case any for the doctor. Now I like to take a pencil. I like to outline the gingival margin, and then I like to take another color pencil and go about 2/10 of a millimeter above that. And mark that so I can keep a place when I go to trim. I also like to go around the linguals of the teeth to outline and show myself where the hard palate is, because we do not want to trim into that hard palate, because that will affect the seating of the denture. We want to keep that the way it is in the impression. Next, I like to take a pencil and I like to trace the morphology of the tooth and show the planes. It does one of two things. It helps me to pick out a denture tooth, and then it also shows me the emergence profile and the twist and turns of the teeth if I want to incorporate that when I go to set the denture teeth after the teeth are gone. And then we have the teeth off the cast. We want to trim the teeth off the cast up to the gingival margin. Then we take our burr and we go a third down into the socket and a third away from that, away from the palate. That's the rule of thirds. That's about 2 millimeters or so in and out. That leaves a nice non-aggressive socket, and it gives us a place to trim the basal of our denture tooth when we go to set it in place. Plus, this is a traumatic experience for the patient. The tissue will be inflamed and swollen, and if they have roots that are broken off and more surgery is required, it just kind of hedges our bets for not being too close in to be too tight with the denture base. And you can see here I didn't go into the palate. Again, stay away from the palate and the hard bone surface, because that's something that doesn't change and will keep the denture from seating. Now I can take the basal surface of the denture tooth, I can sculpt it to where I can lay and approximately as close as I possibly can to the socket, case depending. This allows for a nice emergence profile, and if you'll see here in this next slide, that is kind of where the teeth were to begin with. And that gives a nice aesthetic look to the patient, instead of just willy-nilly throwing teeth against the ridge and giving the patient an over-exaggerated fullness or difficulty in speaking, which they're going to have a hard time to begin with. We want to give them something that's nice and clean and smooth. That gives them some type of sense of normalcy, if that's even a question. Now we have our finished case. We used our Renford Wax Electric Duo and our Wax Profi to help create our contours. And now we're ready to create a silicone index of the integular surface of the denture. This gives the doctor a visual of the way the cast looks. Plus, we can do a clear suck down. So after the doctor is extracting any teeth, if he needs to see anything, trim teeth or anything that's interfering with the denture seating, he can use that to see that. Here's the before and after, and I hope this helps. If you have any questions, again, thanks to Renford. They do make work easy, but not only that, they make work predictable. You can contact me at signaturedental@msn.com or www.briancarsonCDT.com if you have any further questions or you need me to elaborate anything or expand on anything. Thanks and have a great day.